Hi, my name is Dr. David Crownover, and I would like to talk to you today about methods of permanent contraception or methods of permanent sterilization or birth control options. Traditionally, there were two forms of contraception for permanent methods. One was a vasectomy for the male, one was a so-called tubal ligation for the female. And these procedures are still performed today. Great procedures, still perform them. However, they do involve anesthesia, incisions, and some recovery time. There is a third method that's available called an Essure tubal occlusion. Essure just being the trade name. Tubal occlusion referring to a method of sterilization where so-called micro-inserts are placed into the tubes, where the tubes come into the uterus. And this can be performed in an office setting under minimal, if any, anesthesia, without any incisions, and therefore with minimal recovery. So I thought we would talk about the procedure itself and then the advantages and disadvantages of the procedure. So we're filming in a procedure room because this is where we perform this procedure, and this is the table and the tower and or the camera where we can visualize inside the uterus. So as far as the logistics of the procedure itself, the patient comes into the procedure room, and by taking a small camera and looking inside the cervix and inside the uterus, where the tubes come into the uterus, the so-called micro-inserts are placed, again, inside the uterus, again, without using any types of incisions. After the so-called micro-inserts are placed, the patient is discharged to home. Again, this is from an office setting. So I perform this procedure in this room. The typical patient would come in on a Friday morning, for example, around 8:30 in the morning. She signs a consent form. A urine pregnancy test, of course, is confirms that she's not pregnant. The procedure is performed and the patient leaves typically within 30 to 45 minutes. So what are the advantages of the procedure? We've kind of touched on some of these already. One is that it's performed in an office setting. And again, this is an advantage for several reasons. One, the patient doesn't have to go to the hospital, she doesn't have to have her blood drawn, etc. At the time, in terms of taking off work, etc., she's only here for 30 to 45 minutes. And to some extent, the financial aspects of this, many times since it's an office procedure, the patient only pays a copay, for example. Second advantage, of course, is that I mentioned that it's performed by looking inside the uterus, and so no incisions are made. This often requires minimal anesthesia. If the patient has recently delivered a baby, we typically only give them ibuprofen. Even if the patient does require anesthesia, it typically is in the form of a local anesthetic, much like a dentist would use. The third advantage, I think, is that because no incisions are made, the recovery is really minimal. Most patients that we perform the procedure on will say their pain on a scale of 1 to 10 is somewhere around a 2. So minimal discomfort during the procedure and minimal recovery afterwards. When the patient leaves the office, they can return to normal activities immediately. So what are the disadvantages of the procedure? The procedure itself is very straightforward and is minimally invasive, but it does involve 2 steps. Because the micro-inserts are placed in the tubes, it takes up to 3 months for this to scar down around the tubes. So there is a second step, which is a so-called Hysterosalpingogram, or many people refer to it as a dye test, that is performed 3 months after the procedure to confirm that the tubes are in fact blocked. So there is a 2-step process, and it does involve 2 minimally invasive procedures. Most people feel like that's a reasonable trade-off for not having to go to the hospital, have anesthesia and incisions, but it does involve 2 steps. The second disadvantage is that we often perform this after administering so-called Depo-Provera, or an injection for contraception. This covers the patient for 3 months while the tubes are scarring down, but it also helps us visualize inside the uterus. But often patients will have irregular bleeding for the first couple of months after the Depo-Provera injection is given. Again, most patients feel like this is a reasonable trade-off for the minimally invasive nature of the procedure. So this is an overview of the so-called Essure tubal occlusion. Again, it's a minimally invasive procedure for permanent sterilization or permanent contraception, with advantages and disadvantages. And like always, I would recommend that you talk to your own doctor to decide if this is a procedure that is appropriate for you. Thank you.
twice.com.